Hello and welcome to our second session of the mental health series for the city of Reading. This session is for our youth and it talks about trauma and going from isolation to socialization. And we have three very great guests for you this evening. And I wanted to start off by giving a little bit of information about our guests. First, I have Tyler Newton, who's an 18-year-old 2021 graduate of Conrad Weiser High School and is going to share his life experience with us. He was a football player and loves mentoring the youth. And also we have on our panel, Miss MaJuana Mayo, who has been in the field of social services for 25 years and has received a BA in psychology from Millersville and a master's of social work from Temple University. And she's been a school-based health therapist for the past 10 years at Muhlenberg. And just a dynamic person from the community and has always been helpful. And then last but not least, Mr. Tremaine Jones, who's a licensed professional counselor that has served the school-based counselor for the past 13 years and a certified clinical trauma professional also, and has worked with families and children for 18 years. And I just want to correct one thing, and Tyler, and you tell me if I'm correct. Did you graduate from Conrad Weiser or Cocalico?
Conrad Weiser.
That's what I thought, Conrad Weiser. Thank you. But what we're going to try to do this evening is much like we did in the first session, give a real life experience and then let our professionals give some explanation. But before I go any further, we also have the mayor, the people's mayor, Mr. Eddie Moran on. I know Mr. Moran or Mayor Moran, if you wanted to welcome the folks this evening and give some words.
Thank you. Thank you, Mr. Butler, for the opportunity to share a few words and to give thanks. Give thanks to all the participants tonight. Special thanks to yourself, Mr. Butler, also the Judge Honorable Tanya Butler, tonight's awesome speakers, Tremaine Jones, MaJuana Mayo, and Mr. Tyler J. Newton. Special shout out to each and every one of you. Tonight is the second episode of this series that has been sponsored by the African American Community Connection, the Lonnie Walker Foundation, and myself to bring some attention to some really important issues that sometimes we don't talk enough. We don't even talk within our families. I'm hopeful that those that are watching live or on demand and are here locally or tuning in from anywhere in the world, tonight's conversation is an attempt to ignite a thoughtful, deep, healing, honest, sincere conversation about several issues. One, how you can overcome trauma and anything that is you're confronted by. Also, one that is somewhat very personal to me, which is identifying behaviors. So with that said, I'm going to ask everyone that's watching to please share this live feed, to share it with your friends and family, because this is not going to be, my understanding, a conversation that is for those that are confronted by these issues, but those that are in our community so they can understand family members, neighbors, and just individuals out in the community. For example, there's no secret that I have a child with special needs. And in the beginning was very challenging with his behaviors. And going out to the community, it was challenged knowing that some may not know why he was acting the way he was or why he was behaving the way he was. Would look at me, quite honestly, and think that I was being a bad parent or I didn't have parenting skills, or my wife. Yet my wife is a speech therapist, and I was a professional at the time raising this young man that we were all learning from. So again, if I can ask to please share this feed right now so that everyone in our community could gain some benefit from it, it would be greatly appreciative. And again, I cannot thank you each and every one enough for your commitment.
Yes, thank you, Mr. Mayor. And I second your, I've witnessed you with your children, and I commend you for the way you've been able to help them be successful and make others understand and seek help and provide the example of seeking help that some of our parents don't always do. So thank you for what you do. And I'm hoping this evening we can shed some more light and folks can pick up some more tools in the panelists giving information. But I'm going to go ahead and jump right in and get to it. I wanted to start with Mr. Tyler Newton. Tyler has a very interesting story, and really a story that is very appropriate right now. I don't know if our audience is familiar with vaping, but it is one of the fastest growing problems within the school systems within Berks County. And Tyler had a personal experience with it, and we were thinking that his story needs to be heard by everyone, young and old, and that he could shed some light on what happens or what could happen, and how he's able to even be on with us tonight. So Tyler, can you tell us how did you get involved with vaping, or how did it start, or what started you into vaping?
Thank you guys, by the way. It all really started off with just being around it, really, just the image of smoke in general coming out of somebody's mouth, that was kind of a big thing. A lot of us also thought it was cool, not realizing the effects, to it. And yeah, that was just, that's pretty much it, how I got into it, really.
Yeah, so I know that you had a traumatic episode. Can you tell me, or sort of replay what happened?
Well, pretty much I was in gym class, and we had a little break, and I decided to go to the bathroom and hit a vape, an Enjoy, is what it was called. Not realizing what was in it or anything. I went back to gym class, and we had to do the pacer test, sit-up test, and the push-up test. But after the pacer test, I got this really bad coughing spell, and it just wouldn't go away, and it wouldn't go away. And then it started getting hard to breathe. That's when I started to worry. I went to the nurse's office. They tested my blood oxygen levels. They were okay at first, which is what was confusing to people. And I finally went home and waited on the ambulance. By then, my tongue had swollen up and my throat started to close. As I was waiting, I could have never imagined, something like that could happen from such a small thing. But yeah, so I'm on my way to the hospital, and it was really scary. I never imagined, some of the things that they would do to you in a situation like that. I've only seen it in movies. You're thinking it would never happen to me, but the consequences you get when.
You said that they had to perform a couple of procedures on you, and you have vivid memories of them.
Oh yeah, so they intubated me, actually. In the ambulance, I actually don't remember that one. That one was pretty. That was not. It gives me chills thinking about it. Yeah, that was the most horrifying experience of my life, because I'm gasping for air and I can't get it, and I was losing consciousness as well. So that feeling is not the best either. I remember they put something in my IV so they could actually put me on a ventilator. And what that was when I was under, and what I saw is not something I would wish on my worst enemy.
Now, let me ask you: Did you get the warnings, or did in school did they tell you about vaping and that it was bad for you, or what do you remember from that?
I didn't. I always seen the real cost commercials. That was pretty much it. Nothing in school really. There was kids getting in trouble for having it left and right. The school's concern, I feel like at the time, was just the fact that there's smoke on their, you know what I'm saying, like tobacco on their property. They weren't really too concerned about why these kids are doing it. I feel like so. No one really told us anything about it besides maybe the box that we would buy them in. It would tell us, but we often ignored.
So in health class, when you guys would talk about it, they didn't say anything there?
Sorry, I forgot about that. Excuse me. So in health class, I remember in 7th grade, we were learning about drugs and alcohol. And our health teacher, she had asked us she handed out a bunch of straws, and she had told us to put it in our mouths and try and breathe. And let me tell you something, that was probably one of the worst things I could have ever really experienced. If you're a healthy person and you just ran a whole bunch of sprints, that's what it feels like after you're done. And that's something that, like I said, these are things I wouldn't even wish on anybody, even my worst enemies. So that was a pretty big, it should have been my eye opener at the time. And I regret it not being my eye opener. So I feel like a lot of people avoid those things and just not care. So
how did you overcome it and get to the point you're at now?
I honestly, so it was really just, it was more just, putting my foot down and realizing that I didn't want to feel like I couldn't breathe anymore. I didn't want to feel like I relied on something that isn't even alive, if that makes sense. That it's something that I had to, pull through. And, I had goals, and I couldn't pursue those goals while vaping, like with football, that was a big thing. That was hard to do. I vaped during football and I regretted it. That took a big toll on me as well. But yeah, it was just putting my foot down, and there was a lot of cases that I did see that were going around. And I just knew I would probably become a better person as well if I pulled out of it.
Okay, and then you had mentioned that the vaping wasn't really the thing. It was like the symptom or something you did to get away from something else. Can you expand on that?
Right. So I believe that when it comes to vaping, I believe that it's more of a way for us kids, I guess, to escape in a sense. I know in my life, I've seen a lot of my friends, they would stress about school and their grades, and home life. And, and those are the type of things where if those people don't have the right support systems for that, they rely on other things, and that's what I feel like a lot of my peers lacked, and didn't really have the opportunity to have, and especially like traumatic events too. A lot of my friends, they come from broken homes, and that's a lot, most of it too. Stress as well, because people believe that they need to live up to something that they're not, and and that often puts a lot of pressure on somebody as well. And I definitely believe that's what leads to a lot of, not just vaping, but, drug abuse alone, and alcoholism. So, yeah.
Well, thank you. And I just want to remind our audience that we are taking questions in the Q&A. And please feel free to ask questions of any of the panelists. As you know, right now, Tyler was talking about his experience, and I really appreciate your thoughts and your talk. I'll say the same thing I said yesterday. For an 18-year-old young man, you're like one of the most mature young men I've run into. And now I know you were saying that you were interested in the military going forward, but you might have been interested in college. Which one are you leaning towards?
To be honest, wherever God wants to take me, something that I pray a lot about. One I'm definitely more interested in is college, because I love football, and I definitely would like another chance to play football again. So yeah, that's.
Well, hopefully it'll go from your lips to God's ears, and maybe somebody will be seeing this and will let someone know that you're interested in playing football. But I really appreciate you telling us your story, and I hope that your story, if it changes one kid, if it makes one kid think and stop or seek help, that you've done your part. And I thank you once again. And right now, this is a serious problem in the school districts in the county, and it hasn't really been talked about. And I think what you said really leads into why we're really here tonight. That what you were saying, the vaping was an escape. It was really to get away from something else. And I'm hoping that our panelists will go a little bit more into that tonight. But thank you, and we will have questions, I'm sure. So we may have to come back to you. So if you can hang in there with us, we're going to come back to you. Next, I want to go to this is a very good friend of mine. We've worked together for years, and it's funny, we never really worked in the counseling field together, but we were. All these years working in sports, I know now, I've learned over the last couple of years, that's what we were doing. We were counseling the whole time. But the great thing was, I didn't know, is I was getting advice and information and talking with someone that really had a strong background in the field. And I think it's why we were able to help a lot of children get through some rough parts of their life. And I'm hoping that going forward we'll help many, many more. But Trey, I really appreciate you being on tonight. And I know that there's so many avenues in this field that we could take to get to where we want to go to. But how can trauma impact school behavior?
First, I'm going to go back to Tyler real fast. So what you seen Tyler describe was more or less the symptoms. And basically, when you have somebody, and what Tyler said was, he had some issues going on at home. He seen some friends doing some things, and that was his getaway. That was his escape. And what happens is, when you have kids that they suffer from trauma, and they get older, they don't have any distress tolerance skills. So they do what they know best, and usually what they know best is what their friends are doing. So Tyler then engaged in those behaviors. And unfortunately for him, it took a severe situation before he realized, man, hold on, something isn't right. Unfortunately for a lot of kids and a lot of teenagers, that unfortunate situation sometimes can be deadly. So it's very important for us to kind of recognize some of the symptoms and try to address the help when we see it, either in the home setting, in the school setting, community, all of it's, police officers, hospitals. When we see the issue, it's good to have this conversation and try to get the help that they need. Better, younger. Tyler was a very fortunate, he's very fortunate to be in the situation he is, because he came out of it and he's okay. But we all know people that, came out of it and definitely wasn't okay. So that's why I think this conversation is important. Now, regarding your question to, trauma and school behavior, one of the first things that trauma does with young kids, it kind of impairs their emotion regulation skills. So when they get angry, you start to see overreactions of aggression and eloping, anxiety. And in the school setting, it looks different. So, in the school setting, when they get angry, the aggression might not necessarily fit what happened, but it's kind of a trauma response. When you're at home and, there's things that are traumatizing, sometimes, instead of fighting, you have the flight response. And in the school setting, that looks like eloping. So a lot of times, teachers are just like, man, this kid is running out of the classroom, or a lot of situations running out of the school. And what they don't realize is that elopement is that flight response to what's really going on.
Wow. And we, both in the school setting, I have so many parents that come and say, well, they don't do that at home, or I don't see that kind of reaction. And I think your response is spot on, that it is two different environments and it may not look the same. It could be the same type of response, but it may not look the same.
Right. Because eloping to leaving and going to your bedroom in your home looks totally different than walking out of the classroom.
Mm.
That happens a lot. And, it's happened over the years, and being in this field for 25 years, you see that is a lot of reaction to children who just don't know how to verbalize what's going on with them. Communication is a definite struggle for this age group. Being able to put labels on their feelings and what they're going through. And it's easiest to just get up and escalate from the situation.
Wow. Now, what do you tell teachers or adults, like in terms of de-escalation? What should they practice, or what do you think is most useful?
The funny thing is, the thing that I tell teachers the most is to kind of relax themselves, because, when you have a situation, when you have 20 to 30 kids and you have one kid that's really disruptive, then it kind of gets the class going. And the teacher is a human too. So the teacher is kind of, getting going as well. So the first thing that I always tell them is, don't mirror the behavior that you're trying to address.
Wow.
And because what happens is, when you start to mirror the behavior you're trying to address, well, when the kid has to up his ante, because now, the teacher upped the ante, so that's the first thing. And then, the second thing is, and it's kind of weird in a situation where a kid is really disruptive, but the second thing is, you have to actually listen to what is going on. Sometimes we're so quick to respond, punish, send out, write up, or whatever the punitive consequence is, that we forget that, hold on, let me just ask a question. And here's an example I gave you the other day when we was talking. We had a kid that I got called, and, the teacher was like, he's refusing to do anything. He's not doing his work. He's saying he's not going to do his work. He's not doing anything. All he wants to do is sit down, over there and draw. He refuses to do anything, and he's being disruptive because other kids are seeing him not do anything. So when I spoke to the kid, the kid starts crying, and the kid's like, I really like drawing. And at home, my mom, who's, she's actually having a kid. She's like, at home, my mom is, she can't afford to buy me papers and crayons. So I'm drawing on toilet paper, but that doesn't work, And I'm like, okay. So I said, what do you think we can do to get?
Right.
Of course, and that's the technique where I'm trying to get them to come with a solution, So he's like, well, maybe if the teacher allows me to draw a little bit, I'll do some work. I said, okay. I said, hey, that's a great solution that you came up with all on your own. And so I said, how about this? How about we walk back up and we tell the teacher your solution that you gave, that you just gave to me. So we walked up, he explained it to the teacher. And the teacher was like, yeah, we could do that. How about you do X, Y, and Z, and then you could draw and have this start. So he went back into class. I went back up, later on, spoke to the teacher. The teacher was like, yeah, he was fine. He just wanted to draw. Now, in that situation, because the teacher had other kids, he didn't have necessarily time to sit down and figure out what was going on. But the solution was really simple, because of his home situation, his outlet at school was to draw. Now, at school, you have to do work. So now we have to come up with a compromise. But you know how kids are. If you tell them what to do, it's, sometimes they can be oppositional. So sometimes you have to let them come up with a solution and just kind of cheerlead them like, yeah, man, that's so great. You came up with the best solution in the world, and then because they'll do what they want to do more than they'll do what you tell them to do, but that's just a small situation where sometimes us as adults have to just take time out and listen to what the kids are really telling us and not just paying attention to the behavior.
Right. And just writing off of that with Tremaine, it definitely is important to include the child in the solution to the situation, because that is often what the problem is. They don't know how to solve simple solutions that happen on a daily basis. Some of the other issues, I don't know with that student, but I've had students that have struggled with the teacher views them as not, disruptive, not completing their schoolwork, just sitting there and so on and so forth. That could be a learning issue. The child's too embarrassed to talk about it.
Yeah.
So they sit there and they do nothing because they're afraid to ask for help. Other students are going to make fun of them, or they don't like to be stared at when they ask the question, or this peer is going to call me stupid if I ask a question. I've heard that so many times. So that's also a factor too, when you have students who look like they're just not doing work or paying attention and things like that, really not understanding what's going on.
And Bella, there's also a question, I think, in the Q&A. I don't know if you want
to. Yeah, we have a question that says, do you find young people that find it difficult to identify their feelings, hence the reason they find it difficult to effectively communicate their feelings?
Yeah, absolutely. Well, for the first thing, when you talk about identifying feelings, a lot of times how we should feel is kind of socialized into our everyday experience. So, for example, for young males, they're told often, don't cry, don't do this. And I'll give you a sports example because we do sports together. So a lot of times you'll have a kid, miss a free throw or something at the end of a game. He'll come out of the, game's over, team lost, he'll come out crying. So his parent will say, stop crying, right? But to that kid, that's a traumatic experience because he experienced that game different than his father or his mother. So his mother and his father experienced the game just watching it from the sideline, clapping and cheering. But, this small 8, 9, 10, 11, 12-year-old kid is in a game with dozens of people watching him, other teams yelling at him, his coaches yelling at him. He has all this pressure. So he has a traumatic experience in that game, except, his parent doesn't conceive it that way. So in a sense, when he says, just be quiet, stop crying, now we're telling him how to feel. Then what happens is in the school setting, it's like something happens and we're like, hey, describe your feelings, and they just put their hand, they just do this because they're taught not to, express how they feel. So when you talk about identifying feelings, that comes from home, that comes from school, and then it comes from actually, teaching kids what is this feeling and how does this impact my behavior. So to answer the question, that the person asks, identifying feelings is very, very difficult, not only for younger kids, but also for young adults as old as Tyler is, because we're social not to identify feelings. So that is very difficult.
Right.
Yeah, I was going to ask Tyler, do you have an experience like that where, football wise, you were going through it emotionally and you couldn't verbalize it?
There's been actually a couple times. We were actually playing my old school, and back in my head, I know how they play, and we're down like 20 some points, and it's just like I don't know. It's one of those things too. It is very stressful, especially when you're a tool. You're a very great tool, and what you do is what you do is needed. You know, when you're one of those guys who has that little bit of luggage on your back, you know, when it comes to your team, you know, you're relied on, you know, a little bit when it comes to certain things, and that can be really stressful. You know, I remember one time, you know, it's always a fourth quarter story. So, you know, this one time it was a fourth quarter. You know, I had like maybe it was like 3 minutes left in the game, and my coach threw me in, and we're playing garden spot. This is when I was playing for Cocalico, and their running back, he was like 6'3", almost 245 pounds, and my coaches were expecting me to hit him. Mind you, I'm a $130. So, you know, it was one of those things like, you know, you miss a tackle, you know, when you could have saved the touchdown, is, you know, that can be really traumatic too, you know, especially when it.
Okay, no, I have the visual in my mind of this guy running at you. You don't make the tackle, and you come to the sideline, and they're like, "What's wrong with you?" But like Trey was saying, you're out there on the field. They're on the sideline.
Right.
It sounds good.
Different experience.
You're the one that's actually experiencing it. Yeah.
Right.
Yeah.
That's one of those things where it's, especially if you're one of those guys where you're like, you know, you're laid back, you're open, you're nice, and, you know, and you do, and people know you do things for people, you know, and they expect you to do it all the time. Not necessarily all the time, but they don't know when it's your turn to get the help, if that makes sense, you know?
Yes.
And that becomes really stressful on somebody. And when it comes to the classroom and with teachers, you know, you have to really study, you know, your students' personalities, you know, because not every student, you know, can just sit there and write notes all day, because I know I couldn't, you know, and that's another big thing as well. You know, it's not just, you know, trauma and things, you know, everybody has, you know, a different personality, you know what I'm saying? So, and your trauma, you know, can affect your personality, I guess you could say, but that's really helpful as well.
Yeah. So, based on what you were saying, Tyler, I'll pose a question to Trey and MaJuana. What role does the parent play in resolving some of these issues? Well, actually, I was asking Trey and MaJuana.
Well, it's funny because I was just thinking, I mean, you were like reading my mind, because I actually wanted to know from Tyler's perspective, being an adolescent in this generation, with the situation that he went through, what deterred you from going to your parents before the, you know, the aftermath of the stress set in?
It was one of those things where, you know, us kids, we don't hate our parents, you know, we see what you guys go through, you know, and we're not oblivious of it. So when we don't come to you about our problems, it's because we know you guys already have enough on your plate, you know, and we know at some point we're not going to be in that house anymore, you know. Like right now, I can't call my mom and be like, "Hey, I need a Band-Aid or something," you know, because I can't do that anymore, you know. That's another really big thing, you know. We don't really come to you guys because we don't know how stressful it is, but from how it's explained to us by our parents, you know, we can only imagine, and that's the scariest part, is because we don't even know, you know.
Well, I hear you. I hear what you're saying, and that's something I didn't really take into account myself. You taught me something, Tyler. You see the stress that your parents are under and what they're going through, and sometimes you just don't want to be another, you know, part of that stress, and why you may not seek help. Actually, we have another question.
Wanda, before you get to that question, let me answer your original question about parents, because your question was, what can parents do?
Mhm.
So the first thing parents can do, and I say this a lot, is to, get therapy to address their own issues. A lot of times, complex trauma is parents having their own, and it could be socioeconomic, it could be abuse. It could be a plethora of things, but number one, get your own therapy and address your own issues. It's very, very hard to parent when you're dealing with severe anxiety, when you're dealing with, severe depression. There's days you don't want to, you don't even want to get out of the bed. But, there's 3, 4 kids you have to take care of. You have to get them up. You have to get them to school. You have to cater to their emotional needs. So number one is definitely if, you're suffering any mental illnesses on your own, now is the time to get help. So that's the first thing they could do. The second thing they could do, and I mentioned this with the teachers, is sometimes you have to actually listen to the kids. The kids explain a lot, and not only vocally, but through their eyes, through their actions, through their responses. So the second thing they have to do is really, really listen to, what they're telling you, even nonverbal cues, listen to what they're telling you. And I would say the last thing to do, for parents, in terms of trying to either diagnose or limit trauma in their kids, is to kind of provide some sort of safe space, whether that be in your arms, whether that be in a certain room, whether that be one-on-one time. And that looks different to different people, of course, but provide some sort of safe space so you're able to connect, with the kid outside of other siblings and outside of other influences. But if you do, as a parent, if you do those 3 things, you'll be fine.
And support ties all into that. The support is necessary because as therapists, we can talk to the kids and counsel them till we're blue in the face. And if they going home and have none of that support, all the things that we discuss with them is undone. They need the support. And the one thing that is been a struggle to watch these children go through is that the village that we had when we were growing up is not there anymore.
Right.
It's not there. So that's what a lot of these children are missing. And then when you have parents who don't understand the background of mental health or, fear the unknown. So they see their child going through something and it just looks like it's just a behavioral issue and so on and so forth. And they think it can be turned off like a switch and it cannot.
Wow. Both of you, that was, great advice. I was just thinking what Tyler was saying about the, being upset and not going to your parents. My wife and I, have kids in sports, and we've sort of instituted in the last year or so where after the game, we don't ask any questions unless they ask questions, and give them that space, like Trey was saying, a safe space, and give them a chance to process on their own. But it is important that, not only we give them the space, that we let the kids know that we're available, that they can bring it to us, and we'll try to work it out with them. But wow, that was great advice. We actually have another question in the Q&A, and this is a pretty good one. It says, what trends or behaviors have you seen since the pandemic? What differences have you seen? And Trey, I would think that was sort of pointed to you.
Yeah. So the pandemic made it extremely difficult to provide interventions for a few reasons. One, we as professionals, I should say, were unable to spot and address situations of trauma because of the isolation. And then 2, once we, kind of got back enrolled into society and we're moving around and things of that nature, at that point, it's become very difficult to address the more extreme behaviors because we wasn't able to take the systematic steps, to reduce the behavior. So now when I first went back to school this year, it was unlike anything I've ever dealt with in the whole 13 years I've been in the school. The behaviors I was dealing with were magnified times 10. And we all said, well, it's the pandemic, they're used to being in a home, and that's all true. But at the same time, we're still in a school setting, and there's still certain expectations that, that is to be had. So the biggest behavioral trend that I've seen since the pandemic was two things. One was aggression and one was elopement. So now we had kids fighting all the time. And there was a socialization component that they weren't used to. So now there's no social skills. So now when I'm angry, school teaches, unlike the academic stuff, school teaches socialization. So behind the computer screen, there's no socialization. So what's happening is, now I don't have now I'm a kindergarten in first grade, second grade, but I've been, my kindergarten experience was on the screen. My first grade experience was on the screen. I didn't learn to share. I didn't learn, I'm at home with just mom and sister. So now if I'm upset at something, I just whack you across the head. That's what it was. Or I just run out because now I want to go home because now I'm not used to being in this setting with all these people. So I'm running out of school because I'm going home. So we had kids running out, where are you going? Well, I'm going home. It was just too much for them. So the two behaviors I've been seeing personally was aggression due to lack of socialization. And then also just kids just running out of the school. And they'll tell you straight up, I'm going home. I know how to go home. I'm going home. I can't take this anymore. So those are two really extreme behaviors I've seen September and October. It's starting to calm down a little bit now.
Yeah, and I guess I've seen the aggression has definitely been an increase. So I have to say I agree with that. And I work with middle school kids. So between the ages of 11, 15, a few 16-year-olds in there. And the depression rate has gone up significantly. Since 2019, the suicidal rate in our teenage girls has increased by 50%. And since that time, we now have to do an assessment screener, like a mental health screener specifically for the girls, not the boys. It's the issues going on with the boys over the years, whatever, has remained pretty stable. But every time I see a female student, I have to do this screener every single time I see her. Wow. Yeah, so it's definitely been a significant increase. And I have about 45 kids on my caseload. 30 is a full caseload. I have 45 and I have several more on the waiting list. And before it seemed manageable because I've had 45, 50 kids in the past, whatever, prior to the pandemic. But now of the 45 kids that I have, instead of having 4 or 5 of them that have a special need and need to see me more than once a week, I now have 22 of them. So it's tough. It's been very tough. The adjustment for them has been a whirlwind. They just don't know how to function properly within the school setting. Everything has changed, and being on the computer screen, like Trey was saying, it is done something different to them, because now even though they're back in the school, they're still learning through the computer. So I have some concerns about that too, but I'm not a teacher and I'm not part of administration, so I can't say anything about that. But I think sometimes they need a break from electronics, and their minds need to kind of get a readjustment to what the real world actually is, and so on and so forth, because their socialization skills are definitely suffering. They're definitely suffering.
Yes, I would say on the school side, I've seen exactly what you guys are saying, the aggression, not necessarily, well, I guess the flight looks different at different levels, but yes, like Tyler was saying, people resorting to vaping and other avenues of relieving their stress, and really not caring where they're doing it at, because I think Trey's right. When you're at home and you get used to sort of just doing your thing, you don't really worry about consequences. And I think that's what school, these last couple of months, we're trying to reestablish that there are consequences for your behavior. And for a lot of kids, some kids pick it up faster than others. Some kids' parents ran home just like they were in school. Some, it was not. So it's been a bigger adjustment for some and not for others. So, but definitely, the aggression, not only in school, just in society, has been huge. And how to tackle that, it has been sort of the dilemma, because with schools, we look at policy, we look at rules, we look at practices that will maybe not give the opportunity for something to happen. But we also know as administrators, some of the best learning occurs when they get the opportunity to express themselves or to say things. So it's how do you allow them to express themselves, but not get to anger and really are, at least what I see as the real problems, forget anger, they're at rage.
Right.
And it's like Trey was saying, the overreaction to things that seem, not to be serious, has been what I've seen over the last few weeks. So, Trey, I didn't know if you wanted to add more to that.
Yeah. So overreaction is part of the trauma responses we were talking about, and so people can understand. And let me give a quick example. So if a kid is at home and a kid is in a situation where they're experiencing, and we'll get into complex trauma later, and the kid is experiencing abuse, for example, physical abuse. A quick, great overreaction example would be if I'm sitting at my desk and I'm talking to the kid and I go like this to scratch my head and kid jumps, that's an example of an overreaction, but that overreaction is due to trauma. So aggressively, that happens as well. If a kid perceives that they're in a fight or flight situation when it really isn't, but it's because of their past trauma, then they can overreact by being super aggressive. So those overreactions tend to get mislabeled sometimes. So now you have a kid that's labeled as a violent and aggressive kid, but the kid isn't labeled as a kid that experienced trauma. You know what I mean? So now we know what happens. Now the kid's labeled violent, the kid's labeled aggressive. So now we have alternative schools, and we have all kind of other things but it's not addressing the trauma, it's based on the action. So those overreactions is very important for us to label them correctly, so that way we're addressing, the actual trauma. We're not addressing just the behavior, because behaviors can change, but that trauma won't.
Yes. You made me think of what we call ACEs, those adverse childhood experiences.
That's the definition of trauma. Those things that occur, and that actually came into my mind when MaJuana was saying doing those assessments on all those kids and letting that be sort of like the way you filter who we need to work with and who needs more attention. I think that's important. But when you have the vast amount of numbers like we have in the Reading School District, I don't know how you could possibly, go and assess every single kid. And, it's a shame because it puts us in reaction mode. So then it's like, Trey was saying, you're addressing behaviors and never really what the true problem is. And then you have repeated. But you had talked about complex trauma a couple of times. You want to talk to that a little bit more? Yeah, so complex trauma is essentially when a kid is going through a series of traumatic events to the point where it's affecting their development, and it's affecting their self-esteem. It's affecting their moral compass. It's affecting how they interact with others. It's affecting their relationships as they get older. So, complex trauma is repeated physical abuse, repeated sexual abuse, repeated emotional abuse, being put down, having a severe mentally ill parent that's not getting help. So those are components of complex trauma. And we deal with a lot of kids that have complex trauma. And just me and MaJuana, just the field that we work in, we deal with a lot of kids that have complex trauma. And it's limiting because we're only in the school. So at home, we can't deal with, the same issues as we can if we were home setting. So the pandemic obviously gave me an actual advantage, because in the pandemic, we was able to have sessions with kids at home, and we was able to get a better grasp on what was going on at home, whether it be the telephone, whether it be video conferencing. We was able to actually get a glimpse into the home life. And that actually gave me a much better perspective on how to treat the kid in the school setting, because now I get the full 360, picture, but a lot of kids we deal with have, complex trauma. And again, the example that I think of when I think of complex trauma that gets overlooked a lot of times, and I don't know, this might've been about 7 years ago. It was a second grader we had, and, he had some behaviors and he was okay. But after a while, he was just acting out. We couldn't figure out why, so he was hiding under the desk. He was throwing things. He was doing all kinds of things. So when I finally got a chance to get him in the window that he was ready to express himself, because he wasn't, he told me that for the past week, he didn't have any electric at his house. So with him not having electric at his house, we're talking about January. So with him not having electric at his house, it was always dark. He was always sleeping under covers. He was scared to go home, because in January, when you go home at 4 or 5 o'clock, it's dark. You know what I mean? So he was explaining this to me, and I was talking to the teacher, and I'm like, we're trying to address this behavior, but isn't the issue that there's a kid that has no electric in January? So from that point, we changed the focus from these behaviors that he's doing to, listen, I'm at Tyson Chainer. The Salvation Army is literally right around the corner, so I'm like, we can't address him leaving the classroom and acting up in the classroom when he goes home, he doesn't have electric. So, long story short, we did address that, and we got, the family the help that they needed, and the kid was fine. And ironically, I just seen the mom the other day, and he's still doing fine. You know what I mean? So that goes back to what I was saying earlier. Sometimes we look so much at the behaviors, we forget to look into the actual trauma. And these examples stick with me because, these are situations where I get a chance to get underneath the hood and figure out what's going on. And I can then help, the teacher, provide, because I understand their situation too. They have a lot of kids, so they don't have the chance to get under the hood like I do. But I just want to make everyone aware that sometimes we are just treating behaviors, and we're not getting under the hood to find out what's the actual root cause of these behaviors. And not having electric, man, if anybody knows, Maslow's hierarchy of needs, I mean, that's number one. Safety and security is number one. That's right at the bottom. You're not getting to anything if you're not safe and secure. So that's complex trauma leads to things like that. And that's why it's very important to understand what that is.
And the parents being involved is again, an important factor in all of this. And I don't know how, Jermaine feels about it, but I think a lot of the families that I'm working with right now probably do need some intensive type in-home therapy, because we, the field that we work in, we're at the lowest level of care, meaning that we're more or less helping them maintain, the social skills and, other developments and things like that they've worked on in the past. But again, since this pandemic has hit us and things like that, they have backslided so much. And it's a struggle to be able to assist them as much as we possibly can, because we're not getting, everybody's not on the same page. For example, I have a child that I'm working with now that, as I talked to and asked Tyler about, why didn't you talk to your parents and so on and so forth. I have a student that is struggling with being able to express the things that's going on to the parent, because they feel as though they're stressing the parent out, because the parent made a comment that made her feel like a burden. This is going on a lot.
Yes.
No, if you can't go to your parent, the people that are taking care of you and protecting you, who do you talk to?
Yeah, you're absolutely correct. I heard something today from a radio personality, and they were talking about the difference between parenting now as opposed to the past. And they were saying what happened in the past. And I think the three of us would probably admit this. Our parents did a really good job of hiding things from us. We could have been dirt poor, but we would have never known, because our parents, never let us really experience that, or just the way they carried themselves. And they're saying today in parenting, parents are like right out there with their kids. They'll tell them, we got a
Exactly.
money situation,
Right.
we're struggling, and and the kids are taking on more
Exactly.
of the stress and the load than they've ever taken on. And I was like, wow, I didn't really see it that way. But yes,
Yeah.
they were absolutely correct.
Yeah, that's the conversation
Absolutely
we were
correct.
having yesterday. Yeah,
Yeah.
it's definitely there. I mean, I can tell you that I have so many of my kids that know the personal business of their parents and things like that, financial strain, possibility of losing their home and so on and so forth. Dad has lost his job and so on and so forth. And their child is coming to school stressed out because they're not old enough to get a job to assist their parents and things like that. And that's not their responsibility. Or they become during the time of the pandemic and things like that, when everyone was stuck at home, the 12-year-olds were responsible for the 6 and the 7-year-old while the mom is at work. These
Yes.
things have these things have all impacted how they are behaving today. And it's going to continue, and we're not going to be able to get any kind of, happy medium until the support that they have and the support that they need is coming from, all surfaces. Starting at home.
Yes. Well, we have another question, and I think this is really good. Something maybe all three of you could chime in on. It says, with the increasing cases that are more advanced, how are you taking care of yourself? And what do you suggest for self-care for other adults who are working with children?
Where do we begin? It can get difficult because you always think about, who gives therapy to the therapist, right? But just as well as, we teach our kids and we talk to our parents about and things like that, being able to reach out to each other as a support system and things like that. And there's nothing wrong with a therapist having a therapist. It's a lot of that time is necessary. You have to be willing to, open yourself up and say, I'm not feeling good about this mentally and so on and so forth, because it happens to the best of us. And we get tired too, because a lot of our kids think that the things that they're going through, what have you, we have no idea what that's like. But they, some of them see us as superheroes, especially the little ones. And, I think it's really important to kind of can continue to let them know that we're human as well. And things go wrong in our household too, and so on and so forth. But we're going to all work together as a team and work these things out. You have to be able to, to talk about it. You have to be able to talk about it.
So, yeah, first of all, that's a great question. And it's a question that every single therapist struggles with, because, when you're dealing with others and you're dealing with, and you're in a helping profession, people never stop needing help, so your gears are always turning. And in terms of taking care of yourself, I know one thing that's worked for me is to actually, and you probably have to do this physically, like take time out of your day or week to set aside to do whatever it is that you consider relaxing to you.
Mm-hmm.
But the thing about it is you probably have to schedule it, because you can say, I'm going to go here, or I'm going to do this, and I'm going to relax. But as soon as you get a phone call, as soon as you get a text, as soon as you get an email, you're like this. And then even if you don't respond to it, it's still here. You know what I mean? So now, phones are advanced nowadays. Now they have, do not disturb, where you can specify what exactly you don't want to disturb you. So that's very, important. And as far as, self-care for other adults working with children, I would say the same exact thing. You definitely have to specifically dedicate time to do whatever it is that you feel that it's not necessarily fun, but relax it, because sometimes fun things can be stressful and anxiety ridden too, so whatever you consider relaxing, if that's, laying back and watching Netflix, if that's going into the outdoors and going to a park, if that's taking a walk, if that's watching your favorite TV show, whatever it is that you consider relaxing, make sure you take time to do it. And when you do it, don't necessarily, keep looking at your phone or keep looking at things of that nature. And if you have kids, which I do, so, take that time and dedicate to your kids. My kids is in sports, so I'm always here and I'm always there. But when I'm there, I'm fully present. I'm not halfway there. I'm not there and I'm running out. Oh, I got to make this phone call. I got to do this for work. Whenever I'm at a sporting event, for my son, I'm fully present. So that way I'm not taking away from my own kid in service to others. So that's a very good question, but it's still a struggle. I mean, as therapists, we're always going to struggle with that. But that's what I tend to do for my own personal self.
All right.
Yeah. And I'm dying to know what an 18-year-old does to relax and to not necessarily have fun, but to relax.
Well, to be honest with you, honestly, I just take the time to sit in silence. Because one, it's actually good for your ears. Your ears aren't supposed to have constant sound going through them. And two, it's very, when you're alone and you can actually hear yourself without even speaking, your emotions, you can really address how you feel. You can really address how you want to solve your issues. I don't know. I also play guitar too, so that helps me as well. So that was a big one. And I love cars as well. So play around with some cars.
I don't know. He sounds like a music therapy major, maybe. I'm not sure. You ever hear that before, Tyler? Music
I
therapy?
have actually.
Yeah.
Yes.
I think Albright has that.
Really?
Okay. If anybody from Albright is listening, Tyler is interested, and he's a football player. That's my shameless plug for you.
Thank you so much.
Yes. That self-care is very important. I will tell you, and Tyler, I can really appreciate what you're saying about quiet and listening to yourself. I can tell you, I have listened to more 70s and 80s R&B than I've ever listened to in my life. Songs that I just I would hear them, and you just hear them. Now they mean something. The lyrics and things like so. For me, that's what it's been. Music, Earth, Wind, and Fire, and some of these old groups that I hadn't heard in years or hadn't really paid attention to. They are relaxing, but it made me think, wow, they were thinking about this stuff years ago. And, would we have been all better off if we'd have really been listening to that music instead of just dancing or doing whatever it was we were doing. So what I want to do, I know we have time left, but I want to make sure that if anybody in the audience wants to get in touch with you, our panelists, I want to make sure you give your social media or how to best get in touch with you. So MaJuana, why don't we start with you? If somebody wants to get in touch with you for any particular reason.
Well, they can always, I don't have one connected through my job or what have you, but they can always connect with me through MaJuana Mayo, through my Facebook, and my inbox is completely open. I've already had those experiences already. People inbox me and ask me questions about things, setting up with services and things like that, whatever. So I have no problem with that. And you can also use my work email, and it's capital M and Thompson, THOMP, at pbhsi.com.
Okay. Trey?
Well, I don't have social media, but I will have social media soon. I don't have it yet, but they can email me at treylamar@comcast.net.
Okay. And Tyler, this is big because somebody may be trying to get a hold of you. What's the best way to get a hold of you?
I have social media, but I try and stay away from it. Your best bet is to actually text my number. That's the only way I really look at my phone. But I'll definitely give out my Instagram and my phone number. I guess my phone number.
No, just give your Instagram. Don't grab your phone.
All right. That's too much. You're right. It's Flash Newton, except the A is an X and the E is a 3.
Okay.
That's, try to spice it up a little bit,
Okay.
I made that like 4 years ago. I was like in my prime in track,
Man. And just so you make sure you shout them out, who was your recruiter? Who came to talk to you for the military?
Military?
Yes.
Oh, I'm gonna be completely honest with you. I completely forget. If you Laura Fleming.
Okay. All right.
She actually hooked me up with my recruiter. It sounds terrible, but I forget my recruiter's name. So.
Okay. Well, no, he didn't do his job. If you don't remember his name, he didn't do his job.
That's true.
Any recruiters that may be listening, you got to make sure that your poolie or the person you're talking to, at a minimum, they got to be able to remember your name. So that's probably why he hasn't heard from you. All right. So what I would like to do, we have a few minutes remaining, and like I said, this pandemic was the reasoning that we decided to try to provide this the series. The city of Reading and the mayor has been really good about support, and the African American Community Connections has been a sort of support, and the Lonnie Walker Foundation has also been very supportive of our efforts. What I would like to do is give MaJuana and Trey a chance to maybe give some resources or people or places to contact if your kid is struggling in school, who the parents could possibly talk to.
Yeah, so me and MaJuana are both employed through Malvern Community Health Services, and we're in like 1,000 schools. I don't know which ones, but
yeah.
Reading School District. We're in the Reading School District, Governor Mifflin, Muhlenberg, Ole, we're in a lot of school districts. So what I would say, the first thing to do is to definitely, and generally the school counselor is the liaison. So contact the school counselor and definitely get the children enrolled in therapy. That's the first step. But again, I mentioned this earlier in this webinar. As a parent, if you're struggling with anything, anxiety, depression, you yourself has complex trauma from past experiences, make sure you're definitely getting yourself involved in therapy as well. That's extremely important. And also, and lastly, when you start noticing, exaggerated behaviors and things of that nature, try to listen to what the child is telling you. Kids tell us a lot, but we have our own preconceptions in our head. So we kind of conceptualize what they're trying to tell us, but they'll tell you exactly what they want. And examples that I've given you guys, the kids told me exactly what the problem was. Now as adults, sometimes we're like, they're okay, or no, they're just saying that, or they're trying to play us, or but actually sometimes the kids will actually tell you. But it starts in school. If it's not a school situation, or you don't want to bring it to the school, then usually whatever insurance provider you have, they'll have a list of providers. And let me tell you one thing about therapy. If the therapist-client connection is very important. If you go to a therapist and you don't have that connection, you can go to another one. Don't stay into that. Don't just stay just because they said I have to see a therapist. You're not going to get anything out of therapy if there's no connection with the therapist. So, and sometimes it takes people a few times before they find the correct therapist. So make sure you're, going around and getting, the right connection with the therapist, and then you stay with that therapist and you work on things. If you don't have the connection, the therapy is not going to work, and studies proven that.
Okay, and Marv, before you go out, just in the Q&A, they're asking for you to put your contact information in, I guess, in the chat.
Okay.
Somebody's asking if you guys can put it, if everybody could put theirs in the chat. All right. So I don't know if you're capable of doing two things at the same time, but I'll ask you if you have any other resources that you want to give.
Well, we have, again, like I said, as Trace had mentioned, is to definitely reach out to your counselors in school, guidance counselors at first. I know we do utilize where I'm at that when there comes to a crisis situation and things get, a little bit more difficult, we do encourage them to reach out to Service Access and Management, which is SAM. They are pretty good at assisting with providing resources that, you know, particularly are, you know, focused on being in the home and working with the child from a community and home-based perspective and so on and so forth. But there are so many other avenues. SAM is like we use often because they definitely can lead you in a specific direction in terms of what other service providers are out there. Like Pennsylvania Counseling is out there, Berks Counseling Center, Horizons LLC, Concern. They have all of those companies have those services available, whether it's school, in-home, or in the community setting, or all three. Both myself and Trey have done pretty much all those positions: mobile therapy, in-home therapy, school-based, and so on and so forth. So again, being in the home and getting the parents involved, I think is a very important factor in regard to, you know, specifically what's going on today. Because I honestly feel I love my job, I love what I do, but for so many of my kids right now, school-based therapy is just not enough.
And I'm going to make the question a little bit different for Tyler. I'm going to say, who's given you the most help, useful help thus far? In terms of, you could say the vaping or just, you know, life or whatever, who's giving you the most help?
The person who's giving me the most help right now, I would honestly have to say is God. That
Wow.
I couldn't lean on anybody else really throughout my whole life besides God.
Wow.
You know, so that's who I definitely will thank, you know, for everything and anything. So yeah.
Wow, that's almost a mic drop, but I'll just throw two other resources out there, but that was very powerful, very powerful. For kids that are, and you know, not that I'm saying that you are having this, but if you need somebody to talk to and you're having, you know, suicidal ideations or whatever, the Are You Okay Berks is I think they have the text and the where you can call in. And then if you are experiencing problems that are with school or, you know, you're not sure, Safe to Say is one we have in the Reading School District where you can call and talk to someone and ask for help. And if the issue is behavioral or if it's, you know, a problem that's going on at school. What I want to make sure I leave as a last word is we've had some very, very difficult situations on the school scene in the last few days. We've had a mass school shooting. There's been, you know, numerous problems that have occurred. We know that none of these problems are like necessarily isolated, and they weren't. That shooting wasn't really what, you know, that's a symptom of a problem. And I would like to think if that young man or that family, like Juana was saying, if those parents would have sought counseling or help, that we could have prevented that from happening. So I will say once again, if this talk helps one person, just one, or many children or parents or caregivers in our community, we think we've accomplished what we set out to do. So I just want to thank all the panelists again for coming out tonight. I know you have other things you could have been doing, but I want to hope that somebody will contact you from this, and maybe there's something that they learned or experienced or heard that changed them or made them look at things differently. And once again, I want to thank the mayor, the city of Reading, Eddie Moran, the Lonnie Walker Foundation, and the African American Connection Foundation for their sponsorship. Without you, we couldn't do what we do. So thank you. Any parting last words from our panelists?
Well,
you know,
thank you
these-
for inviting me. I mean, I
Great.
definitely appreciate this. So, you know, I'm always looking forward to having any discussion with the matter. I've been in the field for a long time, and it's challenging, but I love what I do. That's why I'm 25 years. I'm still here. I'm not tired yet. Not yet.
Trey?
Yeah. So I've been in, you know, the city of Reading my whole life, and both living, working And I just want to say this to part, when I was younger, I had a lot of behavioral difficulties, and to put it in layman's terms, I was a real knucklehead, when I was in middle school. And when I first went to a psychologist, because back then when there wasn't therapists, you went to psychologists when you had behavior problems. So when I first went to a psychologist, I was almost enamored at how he was gaining insight into my behaviors. And from that point on, I decided that I wanted to use that and help others. And so, with that being said, the last part in words is basically, it doesn't matter how you start, so kids that are acting up and kids that are having difficulties, that doesn't mean that's where they're going to finish. And a lot of times that's what they're told by people, either directly or indirectly with certain comments. But, I'm living proof from, being a knucklehead when I was younger to, going to school and providing guidance to other little young knuckleheads on the come up, I guess. So my parting words are just that, no matter what, just understand that, therapy can help you, it can change you, and you can live a successful life despite any traumas you may have been through in the past.
Okay. Tyler, any last advice for people that are your age or younger that are not sure or maybe what their parents should say to them?
All I can really say to people is, just keep going, and things do get better, and what doesn't kill you makes you strong, so, as long as you keep going, there's always something good that comes out of everything, there's a reason for everything, try and take life with a grain of salt, because, getting angry at things, when you're young, can have an effect on you when you get a little older. So, just definitely, and don't be afraid to ask for help, because if people didn't ask for help, then, the world wouldn't really go around. So.
Thank you. That is a very good one. Well, this has been our second session of the mental health series. The third one will be next Tuesday night. It will be grief, getting through the holidays and beyond, which I think is very appropriate. We're going to have another panel of folks, and there'll be one last one on December 21st, mental health and substance abuse. But next week it will be grief and getting through the holidays. So with that, I would like to thank all of our participants and our panelists and our audience members. As we had said early on, or I guess it was expressed in the chat, this will be on Facebook Live. It's going to be on the YouTube page. You're going to be able to go back and take a look at it. We would hope that anybody that caught this, maybe in the middle, towards the end or whatever, that you go back and look at the whole program, or that you would maybe share with a friend or tell other folks about it. Thank you for watching this evening, and we'll see you next week with our next episode. Thanks, and have a great evening.
Good night.